Hey students, welcome back to my channel Dentistry with Kashaf. Okay, it's a part 3 series of our head and neck blood supply. Like we have started the head and neck anatomy. Okay, today we will study about the blood supply of the brain. But before that, let's go through the different parts of brain. Okay, this one is your frontal part, parietal part, temporal, occipital, cerebellum, pons, medulla oblongata, and your spinal cord. Okay, the brain receives the blood supply from two pairs of the major arteries. Okay, one is your internal carotid artery and the other main supply is your vertebral artery. Let's see one by one. Okay, internal carotid arteries is responsible for your interior circulation. It is about 80% of your brain's blood. Okay, and give rise to two things, ACA and MCA. What is ACA and what is MCA? Okay, interior cerebellar artery that supplies the medial surface of the frontal and parietal lobe. You see here in this color, this yellow one. Okay, ACA that supplies your medial surface of the frontal and parietal lobes. Okay, in the middle cerebral artery, which one is your middle? This green one. This supplies this green part of your brain, which supplies the lateral surfaces of your cerebral hemisphere, like largest part of your brain, which is your cerebral hemispheres. Okay, before moving forward towards the vertebral artery, let's talk about the origin of these arteries. So this is aorta, this is brachiocephalic trunk, which is further divided into left subclavian and your left common carotid, and from here directly it give branch as a right common carotid artery, and this is your right subclavian. And remember, these two beautiful kind of things going from here is your vertebral arteries. These are the vertebral arteries. The right subclavian giving branch as a right vertebral artery, and from the left subclavian its branch as a left vertebral artery. And going further, it is giving this beautiful structure called as basilar arteries, collectively known as basilar artery. We will discuss this later in circle of Willis, like collateral circulation of the brain. Okay, so the common carotid artery is giving two branches, like this is the external and these are the internal. Internal further going upward in the brain and giving as interior circulation, and these vertebral arteries going and giving you a posterior circulation. So if you learn this diagram, this thing will be very clear to you. Okay, let's proceed further. The second part was your posterior circulation, this one, the purple one, and we studied that vertebral arteries are forming the basilar arteries. They unite to form the basilar artery, and the basilar artery divide into posterior cerebral arteries like PCA. That supplies the occipital lobe, the purple one, and inferior temporal lobes. Okay, temporal lobes, the below surface of the temporal lobe, and inferior temporal lobe, and the parts of the thalamus and midbrain, some part of your midbrain. Okay, you can see here the midbrain. Okay, now proceeding further, you will see the beautiful diagram. Here is a circle of Willis composed of anterior circulation and posterior circulation. This whole thing is called as circle of Willis. The circle of Willis is an arterial ring of the at the base of the brain, which is formed by the anterior cerebral artery, anterior communicating artery, internal carotid arteries, okay, posterior communicating arteries, and posterior cerebellar arteries. These, the bigger one. This whole thing is your circle of Willis, and collectively you see it is very easy. The interior circulation, the internal carotid, posterior communicating, and anterior communicating. Okay, what is the function of this thing? For example, if this supply is blocked or this supply is blocked, so this is basically the collateral circulation in your midbrain. Okay, then provides the collateral circulation if one major artery become blocked, and you have to learn this. Okay, let's revise this thing. We have already seen that. So the internal carotid artery will give you anterior circulation. We said that. Okay, responsible for your anterior circulation, these one. An anterior cerebral artery, which we see, it will supply your medial, frontal, and parietal lobes. We have studied, and this is the summary slide. Okay, the middle cerebral artery. Okay, middle cerebral artery that supply your lateral cerebral hemisphere. We said that the largest parts. What are the vertebral arteries? Now here is the posterior circulation. So vertebral artery supplies your brainstem, your cerebellum, and your spinal cord. And the basilar artery, this whole thing is a basilar artery, so of course they supply your brainstem and cerebellum, some of the branches to this cerebellum. And posterior cerebral artery giving branches to the occipital lobe, inferior temporal lobe. Very easy. Okay, at that time it was very hard, but if you learn it step by step, it is a very easy and beautiful diagram. Summary slide. After discussing this, talk about the clinical importance. ACA stroke, MCA stroke, and PCA stroke. ACA stroke is a weakness and sensory loss mainly in the contralateral lower limb. ACA stroke is a weakness of the face and upper limb, aphasia or neglecting the non-dominant hemisphere, and PCA stroke is a contralateral hemonymus hemopia, the visual field defect. Okay, Let's talk about these three beautiful diagrams. ACA stroke, MCA stroke, and PCA stroke. ACA stroke is the anterior cerebral artery, MCA stroke is the middle cerebral artery, and posterior cerebral artery. What we said? We said in this case there will be the contralateral limb paralysis. How? Like sensory loss and motor loss in weakness and sensory loss mainly in the contralateral lower limb. Okay, these are the clinical features like the weakness of contralateral lower limb and sensory loss in the contralateral lower limb. Talking about the MCA, so your face, your limb, your speech, and your one side of the body will be wholly affected. PCA, we see that here will be mostly the occipital part is affected, which is mostly your visual part, like vision related. So your visual field defect, like one side of the both eye field will be defective. Like this patient cannot see the inner of his nose, like inner of his field is defective. Thank you so much for watching, guys, and don't forget to subscribe my YouTube channel and visit my Instagram account. And bye for now, and see you next time.